Welcome to Access Amplified, the podcast where we shine a light on how digital health is increasing access to care and advancing equity around the world. I'm your host, Joanna Brownold, and our podcast is brought to you by Taito Care. In each episode, we sit down with healthcare leaders who are doing the work, not just to reimagine access, but also to rebuild it from the ground up. And today I am really excited to be joined by nurse, innovator, and futurist, Dr. Bonnie Clipper. Dr. Clipper, thank you so much for joining me.
Absolutely, it is my pleasure, Joanna.
So, Dr. Clipper is a nationally recognized innovation strategist and nurse leader, and she spent the last decade helping health systems design and implement innovation strategies that actually work. And often that means starting with nurses. So, I want to jump in. You co authored the innovation roadmap back in 2016. We're nearly a decade past that now. What has changed for better or worse in the way that healthcare organizations approach innovation?
That's a great question. So that work was the seminal work. In 2016, my Robert Wood Johnson executive nurse fellow colleagues and myself wrote that white paper, and it literally was a springboard to get nurses into innovation. So we were early on in bringing nurses into this innovation space. And it was a topic that nurses really didn't know much about, didn't understand. Leaders certainly didn't know how they could leverage it and what to really do with it. So we created the roadmap as a way to address what we saw some of the opportunities and also where they could see barriers and pitfalls. And in doing that, we actually stood up a website and it crashed after a couple 100,000 downloads of that particular
Okay.
document. So it lives on the American Nurses Association Innovation webpage, and it's still an incredibly relevant document. So using that really helps nurses and nurse leaders understand how to take those amazing ideas that they have and how to begin to plan the trajectory about how do you create change. Because as we all know, one idea in and of itself could change the world. However, what we generally see is that you need a plan around, whether that's bringing in the right people to help you advance that work, identifying resources, identifying barriers, creating a timeline, executing on your idea, but doing something with it to actually make that happen. So today, that still is an incredibly relevant piece of work.
And I think that that's one of the challenges that I think a lot of hospital systems face in terms of having that plan and involving the right people in that plan. And obviously, you are very much focused on one of your core beliefs that nurses are natural innovators, which, from the nurses I know, is definitely my experience as well in many cases. What role do you see nurses playing in solving those specifically access and equity challenges through digital health?
Nurses are very much natural innovators. We're very good at MacGyvering things in order to be able to deliver the care that we need to our patients. So when you think about it, there's a real tension in nursing, just like in medicine, because while we're incredibly creative and innovative, we also have some pretty rigid constructs around us that are guardrails for the right reasons, right? We don't want people off just doing their own thing when it comes to patient care because we have to ensure that patient safety is at the top of our priority list. So I think that that's incredibly important. Yet, unfortunately, while nurses are natural innovators, they're often sidelined. So we push them into a corner because, jeepers, you're just the direct care nurse, or you're just the bedside nurse. That is such an old paradigm that we absolutely have to overcome ASAP because the nurses that are providing the care, they know the answers to these problems. They've seen them, they've developed them, they have the solutions. Nurse-led innovation is going to be incredibly important. And what that means is that we often have to take the time to get them involved to help get their ideas, include them in a human-centered design kind of a process, but we need to find a way to bring nurses into the solutions. And I think when we relegate nurses out of those roles, what we risk is that solutions that are half baked, solutions that don't take in consideration workflows or the reality of what patient care looks like and how that unfolds. And nurses are also the professionals that spend the most time with patients and their families. So we really do have to hear their voices in these solutions, and we should be reaching out to nurses more. Right now in healthcare, I think that while access and equity are incredible issues in the US right now, there's a lot of fear around, how do you talk about health equity and diversity and inclusion? Those are things that make organizations a little nervous. We have to be really mindful that everyone doesn't have the same access to good quality care. So, what role can nurses play in improving access or quality or ensuring that we can bring patients into this space to meet their healthcare needs? So, I think we have a lot of opportunity here, and this is just a little bit of a different time. So, we're going to have to get very creative about how we can make this work.
Yeah, absolutely. And I think that, as you mentioned, ultimately the nurses are the ones on the wards in front of the patients, spending that time with the patients and with their families. And often, as you said, kind of MacGyvering within the remits of what they can do, solutions and ideas and problem solving. And that's really where innovation comes from. Innovation often comes from necessity. So a whole bunch of people kind of sitting in a room brainstorming or workshopping is very different than the kind of innovation and the power of those people who are on the ground actually dealing with the patients face to face. And so I kind of wanted to ask you within your consulting work, what are some strategies that you've seen? We've spoken about the importance of including nurses innovation. How do we do that? How do we build a culture of innovation? How do we encourage that specifically amongst nursing teams as well?
Yeah, I think it's important when you are working in an organization or even outside an organization to collaborate around tackling a problem or an issue. It's really important to think about what's the problem you're trying to solve and then ensure that you have the right people in the room to begin to solve that problem. Oftentimes, leaders like to say, hey, we're going to jump in and create a solution because we have to get moving really quick. I like that. However, you're missing the voices of the really important people that are closest to the patients or doing the work. So we have to find a way to take a step back and include some of those folks in the process to begin to really hear that voice as well. Some of this work can be done very quickly, right? We have the opportunity now through tools that literally we can do journey mapping before we even meet. We can send people links and start to do some whiteboarding, so there's an awful lot of stuff that we can do in advance. It doesn't have to slow us down. The risk we run without hearing the voices of those that are closest to the patients are that as leaders, if we come up with these really good solutions, when we try to implement them, they're not going to work properly because we're not the people that actually know all those details.
Exactly. That's when we find the holes. And ideally we want to find those gaps before the implementation process and fill them as part of the building of the solution.
Exactly.
So in terms of digital health design, what does good digital health look like? And how do we make sure that it really supports the clinical workforce? Of course, in your case, specifically talking to nurses, but oftentimes if it's not built properly, it can burden them. And that's not what we want. So how do you look at that in terms of the design process?
Yeah, that's a great question. So I think we have to stop calling it digital health. It's health.
It's health.
And things such as virtual nursing. I do a tremendous amount of work in virtual nursing and virtual care, particularly helping hospitals on the inpatient side really put together a care model. This is not something that's a fad. This is not something that's just going to be here for a couple of years. I mean, literally, the number of hospitals that are adopting virtual care for their inpatients and outpatients and hospital and home patients. This is a way to really extend the continuum. Certainly, there are some efficiencies to gain here. Really, what there is the opportunities to improve outcomes. So I think this is not going anywhere. It's quickly becoming the standard of care. So knowing that all of these digital technologies that input, whether it's a virtual care platform, whether it's something that adds into a virtual care platform, we're going to have to figure out how in this world we now call health do we educate all kinds of disciplines on what they need to know about these technologies, because our practice today is also going to have to change to keep up with what the technologies can do. So in my world, in nursing, we're at a really interesting pivotal time because there's a lot of concern about this thing called AI. Is AI going to take nursing jobs? Is AI going to take things away from us? Certainly, there's the potential to use AI to offload some of these administrative burdens, such as documentation or pulling in all kinds of different inputs, whether it's physiologic care or other things. So I think we do have to educate nurses while they're still in nursing school on what it looks like to provide some technology enabled care. But this is what health looks like now.
Yeah, I was going to ask, do you think that this needs to start as part of the nursing school process? So almost changing the way that we teach the future nurses so that this is not, I think a lot of courses now will have, or degrees will have, a virtual course within them. But as you're saying, this isn't something we should be treating as separate. This is something that is part of the continuum of care now. Do you think that needs to be built in?
Absolutely, for all disciplines, because we're not just talking about nursing. I mean, nowadays, when organizations work with me, they're interested in creating a virtual care team that's nurses, physicians, RTs, PTs, OT speech, nutrition, chaplains, case managers, care coordinators, PCTs or CNAs, observers or sitters. So, literally, we're seeing it across the board. So, I think we do need to educate. We have two groups. We have to educate those that are going to be future professional HCPs. We also need to think about how do we educate and create awareness among existing or incumbent workers in the workforce. So we're going to have to approach this two different ways. That also means we're going to have to educate existing leaders and faculty as well.
Right, which I imagine is harder. Like when you're starting from a clean slate and there's a nursing school and there's a curriculum, once it's integrated into that curriculum, it's easy to teach. Whereas people who have been out there in the world kind of doing it for X number of years sometimes might be less willing to, or not less willing to, but more nervous of new technologies. Have you found that when you've been consulting?
Absolutely. I think that around a more tenured crowd, um, there is sometimes the thought process that we've seen a lot of things come and go, so this may not be around for long, or it's not going to work for all of these reasons. So I think there's a lot of convincing yet to do and outcomes that we have to prove. And to be honest, we still have some work to go on proving the ROI and proving the outcomes. Yet we know in literally every discipline we will never have enough workers. Going forward, we just won't have enough healthcare professionals, period. So we're going to have to figure out what that means in order to change the way we deliver care because our communities are getting older. The need for care is only going to continue to increase. How do we look at both sides of this equation when the demand for healthcare continues to increase, yet the humans providing the care continues to decrease? The
Hmm.
only way to fill that gap is to be very mindful around how do we use technology to assist us so that people, humans, can provide the type of care, hands on, direct patient care that's necessary to solve for this problem.
Yeah. And have you got, I guess, advice for health systems? You've spoken before about the importance of like time, flexibility, and leadership support. How do we leverage those for health systems who want to enable nurse led innovation but don't really know where to start? Or maybe they're getting stuck, or maybe, um, you know, I think a lot of it is also about internal communication. So, do you have advice, lessons that you can share?
Yeah, I think there's a couple ways to do that. For organizations that have shared governance, those groups should be leveraged to help solve problems. And in organizations that do a really great job in shared governance, they are highly effective and functional, and they really are making an impact on work environments, patient care, things of that nature. For organizations that are still on that journey, I think that's what great looks like is how do we engage those direct care nurses in the process of problem solving to help organizations get to that next level in the technology adoption framework, right? What does that look like? How do you get them involved in demos? How do you get them involved in pilots? How do you get them involved in data governance? How do you get them involved in evaluating outcomes and looking at data and metrics for your programs? For organizations that don't have that, I think you can start by convening groups that really are focused around an individual issue and making sure that you bring direct care staff into that, not just nurses, you also want physicians, some of the other disciplines as well, depending on the problem you're trying to solve. So I think there's different ways you can go at this. But the more that we leave these groups out, these direct care staff, I think we're gonna see things actually move forward, but then slide backwards
Hmm.
because we're gonna have to continually tweak and iterate. So going about it together through a human-centered design process really will allow us to go slow to go fast down the road, and hopefully it's gonna be much more cost effective and much more efficient in that process as well.
That makes a lot of sense. I mean, that's what we see as well in terms of once people hands on are part of planning, are part of using whatever the new solution is, they're then much more invested in that. They've had a hand to play. Have you seen common pitfalls across the organizations that you work with? I guess like the opposite question. So like what hasn't worked where digital tools haven't improved access to care?
Yeah, that's such a really good question. I think there's a ton of tools out there right now. So when you think about that, what does that actually mean? Are we looking for tools that simplify the process of making patient appointments, or there are tools that allow patients to connect for transportation? So much of it depends truly on the commitment of the organization from a resource or finance perspective. Is this something that we've purchased or that we've acquired to actually put in place and use it? Are we committed to that? Or is it something that we're testing and we have some outcome goals in mind? And if it doesn't work properly, it makes all the sense in the world not to move forward with something that isn't working. But then
Hmm.
is there a backup plan? Is there something else? Or do you just slide back to what you're doing that may or may not be effective? So I think resources and leadership commitment are always at the top of the list in terms of how do we make some of these new innovations stick and work. The other part of it is change management. I cannot overstress the importance of that. So regardless of how amazing the new technology is, there's all kinds of shiny objects out there. So no matter how incredible the tech is, without incredible change management that never stops, this is like the never-ending gobstopper. Change management never stops. So when you identify a technology that you're implementing as an organization, you have to have champions that are dedicated to owning that and making sure that they are accountable that this thing will forever be highly successful. Because you're going to have people that pop up as your barriers, some of them at the start, some of them at the middle, some of them down the road, and they're going to have things to say, or they're going to wait for this to die off. Every culture is different in an organization. I have seen some that are absolutely incredibly strong in terms of waiting for things to just go away because everything else goes away. So we have to do a lot of work on organizational culture and help our leaders with change management in order to make any of these amazing technologies stick in the long term.
That's a really good, and I was going to say, as part of that change management or I guess ongoing process, when it comes to onboarding new staff, whether it's nurses, physicians, are there recommendations? Obviously, each organization will have a different culture, will have different processes. Is there a advice that you have to help the new staff as they come on integrate as quickly as possible into that system and into that innovation?
Yeah,
Is
I've
my
seen that
internet
happen a
being
couple seen that happen a couple of different ways. So I think when we orient or onboard new staff, that's an opportunity for us to talk to them about the fact that we want to hear their ideas. We want to hear from them ways we might be able to do things better. None of this is personal, but it's about how can we do it the best way possible. What does best mean? Does it mean it's cheaper, faster? The outcomes are better. Every organization gets to decide kind of what works for them and what they're looking for. But I think we want to make it clear to everyone that works there, we want to be the best and we want to excel in this organization. So we need to hear your ideas. And if we're buying technology, we need to hear your thoughts. Sometimes we're going to make hard decisions and we might do things that you don't like or you don't agree with. But ideally, when we can meet a set of goals and identify our metrics and the reason why we're doing certain things, we're going to have to plow ahead. And that also means that we have to be willing to slow down or pause in order to tweak things and to make them work in the best way possible.
yeah. That will make sense. And as you've kind of worked across so many different health systems and with so many different teams, do you have any examples of whether it's health systems or nurse innovators who have really made a difference, and what can we learn from how they've from
I think the organizations that I've worked with over the last many years that have done the best are organizations where starting at the top at that chief nurse executive, they actually empower the leaders and the staff to do things that are going to improve the way they deliver care. So that often means supporting those nurses, whether it's the time to attend some design sessions or the time to attend shared governance, and listening to their ideas. So whether that means things like rounding on the units regularly, nursing town halls, we have to really facilitate this communication so it doesn't feel like there's miles and miles between the top, the middle, and the bottom, right? We have to really figure out how do we make that as seamless as possible. And again, organizations that do the best on this use shared governance to continually hear the voice of the direct care nurses in how they can solve their problems. So I think the more we can start to pull nurses into our problems and hear them as far as solutions go, that can only lead to better outcomes.
absolutely. And I want to ask a little bit about your journey now. You've been in the healthcare industry for a while, both as a practicing nurse, as an innovator, on the inside and outside of health systems. What keeps you inspired? And what are you most proud of in the work that you're doing now?
I'm going to answer this in a way that sounds very schizophrenic. There is part of me that has never felt more fear and concern for what we face today, particularly in the United States, even worldwide. And at the same time, I am continually inspired by young people because they think so differently. I love the fact that young nurses, when they get ticked off, they literally are ready to quit and just walk away. I love that because for me, they have such values that they're literally willing to give everything up to stick to what's most important to them. However, when you're the leader, it's maddening that they're willing to just do that when they get ticked off to kind of pick up their toys and go home. So I think there's a real tension in this space that we're going to have to figure out how to deal with. There are some things that are happening, and I think the future for us is kind of concerning. And at the same time, I think that we're going to have to leverage technology. And eventually, we are going to have to listen to young people that have very, very different perspectives and opinions. And we're going to have to do some of this stuff, or we're going to be in real trouble, not only in the US, but we're seeing a lot of disruption around the world in healthcare right now.
Are you seeing lessons globally that can be brought back to the US to kind of fold into nursing systems within the US?
Yeah, I mean, I'm fortunate because I actually do some work in Europe as well. And there are some amazing things that are going on literally around the world. So I think we all can learn from each other. We need to figure out how to be able to import more voices from an international perspective and identify more best practices. Certainly, looking at the evidence and seeking out literature is one way to do that. For many organizations, because there is some financial pressure right now across the system, a lot of organizations are pulling back on sending people to conferences and things of that nature. So we're going to have to get clever at how we can really get information conveyed and examples and the stories of how we've implemented this or that so that we can move in the right direction around the world, right? Whether it's how are we changing things in nursing school curriculum, producing nurses in our pipeline, or how are we delivering patient care in a very different way? How are we implementing virtual nursing in our communities? I think we're going to have to get very smart about how we can convey this information and learn from each other faster than we ever have before. At the same time, we know that we're facing financial pressures that mean we're not able to always get people face to face to have those conversations.
I wonder if technology could solve that, Dr.
Hmm.
Clipper. So I want to thank you for your time. That's all we have time for. But thank you so much for joining me today.
It's always my pleasure talking with you, Joanna. Love it.
Thank you. For all of those of you listening, if you did enjoy today's conversation, please be sure to follow or subscribe wherever you get your podcasts. New episodes drop every 2 weeks, and please share this episode with a colleague who's passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by TytoCare. I'm Joanna Brownold. Thank you so much for listening, and we'll see you next time.